Hi friends, morning. I'm Dr. Ashutosh Gupta, and today we are going to talk about fetal ventriculomegaly, right? To give you the perspective, an adult brain is something around 1800 grams. Okay, so this could be one of the heaviest organs in our body, but we really don't feel like carrying that much of weight onto our shoulders because it works on a principle of an hydraulics, right? So meaning thereby that our brain is filled of cisterns, इसमें सब hollow spaces होती हैं which are being filled up with fluid, and therefore that makes it sort of a lighter. Now the first part is this that we do have lateral ventricles through which the CSF, the fluid which is there in the brain, it is called as the CSF, cerebrospinal fluid. So the lateral ventricles they make that CSF, and through those lateral ventricles they get into the third ventricle and into the fourth ventricle, and through the aqueduct it gets into the spinal cord. So there is a some sort of an sort of an schematic behavior of the cerebrospinal fluid from which it forms and then gets percolated into the spinal cord and gets absorbed, right? And median, meaning thereby that the max sort of an diameter of the ventricles is mostly around 7 millimeters or so, 7.7 millimeters, and that happens at 17 weeks, right? And the 10 millimeters at the atrial diameter of the lateral ventricles become the higher upper limit of being normal. More than 10, we called it as a ventriculomegaly. This could be mild, moderate, and severe depending upon the variety that we have identified first. So we can classify these ventriculomegalies into mild, moderate, and severe. So depending upon the etiology also, then probably we can have a lot of variations. Why is it happening? It is unilateral or bilateral, or probably what exactly it is, a triventricular ventriculomegaly, or what could be the possible etiologies. Secondly, the close differential diagnosis is about the corpus callosum, right? So corpus callosum can have a complete genesis of corpus callosum, or we can have a partial dysplastic, hypoplastic sort of an event going on with the corpus callosum, and therefore they might even also look like bilateral ventriculomegaly, but mostly they are colpocephaly. Colpocephaly meaning thereby that the ventricles become a teardrop and all those stuff, and we do have a teardrop, and then the frontal horns are slightly divergent, and therefore we try to look around for the corpus callosum in a sagittal view, and there are racing car and horn sign and all those stuff. So, meaning thereby that the CACC or PACC could be the differential diagnosis of this biology. So today we are going to talk about a very important case, and then probably we'll talk about the differential diagnosis. Mostly, this is a 17 weeks sort of an fetus and bilateral ventriculomegaly. We are having this dangling choroid bilateral, and then we are trying to look around for the thumbs. So we are trying to look around for the adducted thumbs. ये अंगूठा है दोनों हाथों का, which is normal at the moment, right? And then we try to look around that this could be in high riding third ventricle. So this could be the cause and the effect also. But probably what we're dealing with is a severe variety of ventriculomegaly and bilateral dangling choroid. Choroid plexus दोनों लेटे हुए हैं, which is called as a dangling choroid, right? So independent भी ये severe variety है. So what we are having is an hydrocephalus ex vacuo, meaning thereby cerebral tissue काफी कम हो गया है, and then we are dealing with a bilateral ventriculomegaly. So ventricles are severely dilated, so which is at 12.4, and then bilateral, and then we are having a dangling choroid plexus. So meaning thereby that we identify that from the lateral ventricles and to the third ventricle, the CSF is not going. So most likely diagnosis is a post-obstructive or post-infective. There is an obstruction. So meaning thereby that the baby does have that infection that comes through the mother, and therefore we are having that sort of an but post-infective there could be an obstruction, and therefore it doesn't allow the CSF to flow. And in the meantime, what happens is this that the ventriculomegaly, the ventricles they enlarge that much that they allow that they do a back pressure onto the cerebral tissue, meaning thereby जो ग्रे मैटर है जो सेरेब्रल टिश्यू है और वो धीरे धीरे मतलब खत्म हो जाता है, राइट? एंड देन ऑल ऑफ द ब्रेन इज बीइंग फिल्ड अप विद द CSF एंड cerebral spinal fluid. अगर वो ऑब्स्ट्रक्शन टाइमली रिलीव नहीं होता है तो उससे बैक प्रेशर होने की वजह से जो सेरेब्रल टिश्यू है वो वो धीरे धीरे खत्म हो जाती है. उसके कुछ कुछ डिफरेंशियल डायग्नोसिस भी हो सकते हैं दैट प्रोबब्ली दैट वी हैव टॉक्ड कि CACC और PACC हो सकता है, क्योंकि वेंट्रिकल इतने ज़्यादा डायलेटेड हैं तो उसकी वजह से भी ऐसा हो सकता है कि वो CSP को उन्होंने दबा दिया है, और हम ऐसा मानते ही हैं कि बायलेटरल जो लेटरल वेंट्रिकल्स हैं उससे थर्ड वेंट्रिकल की तरफ जो कम्युनिकेशन है वो ऑब्स्ट्रक्ट हो गई है, एंड देयरफॉर बिकॉज ऑफ दैट पर्टिकुलर पार्ट वी आर हैविंग दिस हाई राइडिंग थर्ड वेंट्रिकल. So high riding third ventricle could be in ultrasound finding could be the cause and the effect. right effect is this, that probably we are dealing with a bilateral severe bilateral ventriculomegaly, and we really don't know whether this could be some sort of a variety of an PACC, partial agenesis of corpus callosum, can be associated with that. But since we are seeing, since we are dealing with a severe bilateral ventriculomegaly, which is something around 12.4 millimeters, we could have expected it to be something around 7 millimeters. Anything which is greater than 10 millimeters is definitely abnormal. पहला दूसरा ये है कि हमने ये देखा कि बाइलेटरल जो कोरोइड प्लेक्सस है वो डेंगल कर गए हैं, मीनिंग देयर बाय दैट वो उसको लेट गए हैं, सो मीनिंग देयर बाय दैट वी आर डीलिंग, डेफिनेटली वी आर डीलिंग विद सम सॉर्ट ऑफ सीवियर वैरायटी, एंड इट इज um, and we can have an hydrocephalus ex vacuum, meaning thereby that this sort of an obstruction and this fluid accumulation into the brain has led to some back pressure changes onto the cerebral tissue, and therefore we are having a cerebral cortical atrophy. So for all practical purposes the prognosis becomes sort of a dismal, and then we try to look around for the thumbs adducted हो जाता है, so thumbs are like this, okay. So if we are dealing with an X-linked hydrocephalus, so the thumbs are adducted like this, and therefore so we can have some other variety of hydrocephalus which can happen, and which manifest like X-linked hydrocephalus. इसका भी एक जीन होता है और वो typical सा, so 50% उसकी रिस्क ऑफ रिकरेंस हो सकती है, and therefore the thumbs were normal, right. ये एक्सेलिंग हाइड्रोकेफेलेसी काफ़ी सीवियर एग्रेसिव होता है, सो प्रोबब्ली डिटोरेट्स वेरी रैपिडली, एंड उसकी रिस्क ऑफ रिकरेंस भी थोड़ी सी ज़्यादा होती है, and that is how it is. But at the moment what we see is this, that probably we are dealing with some sort of an severe variety of ventriculomegaly, and and therefore and therefore the prognosis is not that way. Okay, thank you very much for your patience.